Hello, everyone. I have with me Dr. Anush, who just scored a second rank for medical oncology in the NEET SS group. Welcome, Dr. Anush, and a huge congrats, first of all, because it's a huge achievement. As you all know, it must have been a long journey. We are quite interested to know your journey about how you reached here. But first of all, a huge congrats. And again, welcome to the club, to the Medical Oncology Club.
Thank you, sir. I'm very grateful to have interview with you.
The pleasure is all ours. Yeah. So, before we start, can you just briefly tell us about your background, where you are from, where did you do your UG, PG, and all of those things?
Yes, sir. Uh, I am from Pune, Maharashtra, sir, and I have did my MBBS from ACPM Dhule.
Hmm.
Then I have did my post graduation in internal medicine from NMCH Patna, sir.
Okay,
Uh,
okay.
I com I completed my MD in 2022, and from
Mhm,
since then I am working
mhm.
as a SR
Okay. So you have been
in
working in
Department of
oncology
Medicine.
department or in general medicine?
In general medicine department, sir.
General medicine department. Okay, okay. So you have been. How long have you been preparing actively for NEET SS?
Sir, firstly, I was preparing general medicine group at
Mhm.
since 1 year. Then, as
You had
pattern
medical oncology in
change,
your mind from the beginning, or was it a late decision towards the end?
uh, till the end of my residency, I was not clear about the specialty.
Hmm. Hmm.
But
Hmm.
oncology was always in my mind. Like I
Okay,
was always fascinated by the oncology, but I had less exposure comparatively
true.
in my residency.
Hmm.
But that's how.
That it was in your mind of the priority. So when the pattern changed, you decided to stick to medical oncology rather than going for the internal medicine part.
Yes, sir. After the
Okay.
pattern change, like I have
That
decided
you
to
had
go
to
for
make up your
oncology.
mind whether it's oncology or the whole thing. So you decided to make
Yes,
up your mind on this.
yes, sir.
Nice,
Like
nice,
I
great.
have studied medicine, and all of a sudden I have to switch to oncology.
I was going to ask you that. That was a brave decision because, for someone who has been working in general medicine for 2 years, then there is a sudden pattern change suddenly, and then you decided to, give up Harrison by many ways and, choose oncology, which is not really well covered in Harrison, which is not covered in your MD residency as well. So that was a bold call. So I mean, it'll be a lot of people will be curious to know how you planned your studies, how much time you dedicated exclusively for medical oncology. I think you would not have had too much time, right? Because the pattern change came rather late. Must have been just a few months.
Yes. So actually, I made my mind and actively started preparing for oncology by end of the December. So
Okay.
from that point, I have never looked back, and I have prepared. I
Okay.
have given
Okay.
my best all time to
Nice.
the
So until
oncology.
December, you were studying medical oncology as a part of the NEET SS package, like just a part of it,
Yes, yes.
not focused on it.
Yeah,
Okay.
mostly hemat-oncology and solid.
Yeah.
I haven't covered much.
So you could manage to cover solid in 3 to 4, I mean, even less than that, right? Just a few months.
Yes. Yes.
Great. Nice. So how did you go about your preparation? What was your strategy? Uh, which all, what were your references? To cover the oncology in a short time must have been a hard task. So,
Yes. I always believed in Marrow. During my PG preparation, also I used Marrow. So I
mhm,
completely studied Marrow during that time also, which gave me fruitful result. So this time
okay.
also I believed in Marrow, and I started preparing from
Okay.
the I I have prepared from the Marrow notes of solid medical oncology and hemat oncology, and I
Hmm.
have watched almost 50% of the videos which I was feeling difficult.
More important. Okay. Difficult.
Yes.
So you went by
And
videos and the notes mainly.
yes, first,
Okay.
firstly, I thoroughly studied the notes and videos also I have did. Then I
Hmm.
have started solving the modules, MCQ modules. which I
Great. Okay.
completed. After every some group of topics, I used to do the modules of that topics, and
Hmm.
whatever extra points or extra topics which I have to get into that modules, I used to add in my notes. Side by side,
Okay.
I have added some few pages for extra notes like that I
So you
kept on
looked at
adding.
some other source and added whatever extra points you were getting from other textbooks and all you
Yes.
were adding.
Mostly, sir,
Okay.
from MCQs, from Marrow, Pearls,
Mm-hmm.
and few other MCQ platforms, and I use PubMed
Mm-hmm. Mm-hmm.
and other website like
Did you
UpToDate,
refer any?
Netscape also.
Okay, so you went session by, for example, you looked at you thoracic oncology or lung cancer, and you
Yes,
went through that the videos and the notes, and tried to solve the MCQs from that. Whatever extra points you were getting, you were adding onto it and creating your own note bank, sort of. That was your
yes,
way of going about
yes,
it.
sir. Yes, sir. I used to cover first one section, then I used to solve the question, and I have to consolidate everything, every extra point I used to get from. I
Okay,
used to I added from GTs and all.
nice. So you got time to go back and revise also, or
So I was able to revise it twice after completing, but for
okay,
first read I have gave 2 months to complete that.
okay, okay. Then in the remaining weeks, you went back and revised whatever
Yes,
you
sir.
could.
Yes, yes.
Okay. How difficult was it making this? Is because maybe this gyneconco, breast onco must have all been new to you, right? I mean, uh,
Yes, sir.
yeah.
It was.
So
You,
you
you,
concentrate on the MCQ areas and the high yield topics and went about it, right?
yes, sir.
Okay. Did you refer to any of the standard textbooks in oncology? I guess no.
Uh,
You wouldn't have much
no,
of time.
sir. I didn't have that much time, but I believed in the content which Marrow provided. I was so much hopeful.
Yeah.
I believed that
That's
it
what I
will
mean. It's
cover.
not possible to refer standard textbooks within a short period of time. And I personally believe the standard oncology textbooks are for DM students. They are not meant for a entrance level preparation. You don't need to. It's not smart work. If you would need 3 years to basically finish a standard oncology textbook. You can't do it in a few weeks or a few months anyway. So, smart choice. I think not to clutter your mind with too many choices. Trust the source that you're relying on, and then build your own way around it. That's the right way of doing it. So, what would you suggest are the key areas for you from the current pattern, going by your experience of giving the exams, your analysis of the question paper, and with someone who came without much of an oncology background, which all topic other than hematology? Of course, hematology is a big chunk. So, other than hematology in the solid organ part and general oncology part, which all areas do you think a candidate should be focusing, depending upon, I mean, based on your this year's experience?
So, as I saw the exam, I thought that pharma oncology was most important. Then medical oncological emergency also was a lot
Important.
of
Okay.
question in that bedside questions were a lot of there. Many of scoring were asked. Like there were many questions on catheters, many questions on corona scoring,
Mhm.
and many questions on tumor lysis and other oncological emergencies like superior vena cava syndrome. All
Okay. Okay.
that like they have asked many peripheral topics. They have
It was
asked
not hardcore in-depth oncology. It was more of
yes, yes,
general oncology and then some pharmaco. That was the main bulk of the questions, right?
yes. Core
Okay.
topics and questions on core topics were comparatively less, and
Okay.
they have covered all peripheral topics mostly. So,
Okay.
like,
So it was not like they were going into the exact regimens of chemotherapy regimens, drug cocktails. They were not going to that much detail. It was more of the generals, the pharmacology, the peripherals sort of thing, if I'm right.
yes, sir. Yeah.
Okay. 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 So then for people who you have been trying for you have prepared for the last year's NEET or NESET also, or this was your first or second serious attempt?
Last year also, sir, I prepared for general medicine group, but
Hmm.
I haven't prepared for I'm onco. that
Okay.
time.
Okay.
So,
Okay. No.
so this year's it was first time
You're
that I am
proper
taking
serious
oncology.
thought at it. Really? Okay.
Yes, sir.
Okay. May I ask? I think a lot of people would are still there who are trying to figure out which specialty to go for. Can I ask you what motivated you to think of oncology? Was there any specific teacher or something in your personal life, or was it purely a professional decision that you like oncology the most? Can you think of something that prompted you to take medical oncology in some ways?
So oncology itself is very fascinating, like cancer cellular biology and the
Mm,
upcoming targeted therapies. All these are very much stimulating topics, and there are lots of updates and research going in oncology. Like I have
true. The most dynamic
like
field now.
it's dynamic and most
Mm,
fastest growing subspecialty,
okay. Okay.
and
Okay.
it also gives opportunity to support and patients in their most vulnerable phase of their life and to treat them and which fulfill my work purpose also.
Absolutely. So that's great. That's great to hear. I mean, that's the only thing that will keep us growing also, going also. It's a tough job. I mean, we will have to break a lot of bad news, bad prognosis, breaking the bad news. There'll be good days, there'll be bad days, but then if you are fascinated by the science of it, and this prospect of making someone's life a little better, even if it's bad news, if you can make them feel better, that's the only thing that really sustain. But no other motivation will really keep us going in oncology. That's what I've always felt. As years go by, that's what I've kind of realized. You need to believe in the dynamic nature of the science and also giving comfort to the patients. I'm glad you told me the reasons that even I had in my mind when I kind of chose oncology at that point. So, anything else you want to tell the future candidates? Something specific, or something general rather, when they begin their preparation, as someone who has now crossed the bridge, do you want to tell them something specific? What should be your mindset? How to choose your material? How to go about the pressures? Something in general.
Since the beginning of the preparation, I every day I used to manifest that I will perform my best and I will give my best. Like every day I used to try whatever time I used to get. I used to completely dedicate in studies, and I believed in myself like that
Nice.
I will perform like that.
Okay, so
I have
basically,
never
there's
let down my motivation. And
okay,
the one thing I want to add, like that, I'm truly grateful to my family, friends. My parents have been always been my so support system, and my wife also supported me emotionally every time.
great, great,
Like all
great.
my friends and my family all always motivated and encouraged me to achieve greater heights. So this all boosted me, and
Of course,
like
I mean, there's
you have to, and further you have to, sir. I think we have to trust what we are studying. Like we have to not have fear of missing out like some topics or anything there. And anyhow we can't cover 100% of topics. I don't
true.
think that no one is able to cover.
No one can cover. I mean, no one can. Even if you ask a fresh DM pass out to write your exam, he won't get 100% marks. So there are people who nobody can know the 100% marks. Absolutely.
Even day before of exam also there is some topic which is new to us. Like we keep on
Don't panic on
studying.
that. Trust what you have
Yes.
prepared. Basically, is what you're saying.
During exam our subconscious mind will take out the that what we have studied and what concept we have built. That will any question exam like any question we can able to solve like if we build good concepts about the topic and subject.
True. True. So basically, no substitute for hard work. No substitute for self belief. Don't panic. Trust the process that you are doing. That's what basically you are saying.
Yes,
Great. Great. That's great work ethic. Really great to listen to your story. And a special congrats, because I know, being someone who came into medical oncology from a general medicine background too, I know that, even when I was speaking to the rank one yesterday also, and when I'm talking to you, I'm kind of really surprised that you could cover the solid organ, liver on hematology. You have some hematology exposure as part of your MD. So to
Yes,
cover solid organ within such a few months, that kind of blows my mind. I mean, like, and that also shows the that your strategies that you employed, the sources you trusted, and your clarity of your thought and your hard work really paid off. Personally, I find it very surprising. I can't think of cracking solid organ within 3 or 4 months with such, obviously you're top of the list in the country. That really blows my mind, and that's a testimonial to the amount of hard work and faith that you have shown in yourself. I feel proud to listening to this.
thank you, sir. Grateful.
So that's it. All the best once again. Again, welcome to the Medical Onco side. Hope to see you somewhere. As I hope that our journeys cross paths. Great to have you. Thank you.
Thank you, sir. Sir, lastly, I want to add that
Yeah.
I enjoyed your videos and Sumit sir's videos. So like I learned a lot from that. Like I was new to oncology study and I have cleared a lot of my concept from those videos, sir.
Thank
Like,
you. Thank you. That's great.
very
Thanks.
grateful to have that
Sure.
access.
Sure. Thank you. Really look forward to meeting you. I mean, there will be conferences, stuff coming up. We'll definitely bump into each other.
Yes, sir. Definitely.
Sure. Thank you. Thank you. And congrats once again.
Thank you, sir.